Great, thanks, Anne. I'll go ahead and share my screen so I can pull up the PowerPoint. Everybody see that okay? Okay, awesome. So yeah, like Anne said, I am a part of the team that's provided the process evaluation supports for the coordinated enrollment work that happened last year. And my name is Mackenzie Burton. I use she, they pronouns. And wanted to also give other folks that are on the evaluation team that are on this call a chance to introduce themselves as well.
Hi, everyone. I'm Catherine Pears. I use she, her pronouns, and I am part of the evaluation team coming from OSLC Developments Incorporated in Eugene.
Not sure if Laura is on the call, and Cass Anderson is another one of our team, along with Beth Green, that worked really hard to support this piece of work. But yeah, I think it's just Catherine and I today. And then I didn't know if early learning division folks who have also been a part of this work want a chance to introduce themselves here.
I can say a quick hello for those of you who don't know me. I'm Jenny Mendoza. My pronouns are she and her, and I'm the Research and Evaluation Manager at ELD.
Hi, everyone. Thanks for being here. My name is Carmen Ellis. I use she, her pronouns, and I am the Director of Community Systems at the Early Learning Division, and currently filling in also as interim Early Learning Hub Manager since our Early Learning Hub Managers both left. So here are multiple functions here today, and I'm really looking forward to this conversation. Appreciate all your time.
I'll go ahead and move us along if there's no other introductions that we want to cover. So just wanted to give a quick overview of what we're hoping to discuss today. So I'm going to be doing an overview of what we were hoping to learn from the coordinated enrollment process evaluation, and then share some key findings from the self-assessment that was completed by the hubs last spring, and the conversations we had with hub staff last fall. And then Catherine will be sharing some key findings from the family survey that we that the hubs helped us to administer last summer, and we'll have some opportunities.
Your doctor's office or CVS?
For us to invite folks to reflect through a Jamboard, and then we'll also have a breakout discussion at the end of the key findings, so folks can have a chance to reflect on what this may mean for you and for your region. And then our early learning division partners will be sharing with us their next steps and how they are working to incorporate the recommendations from all of the information that we were able to gather. And then we're hoping to share a proposed timeline for what we're planning for this year, and get some feedback from folks to make sure that we are doing our best to not be an additional burden for folks in what we're asking. And feel free to, as we're working through the presentation, put any questions or thoughts in the chat. And I believe Laura will be helping to monitor the chat for us. So first of all, wanted to just say a huge thank you to all of the families who participated in the survey and all of the Hub staff who helped to support the creation of the family survey and who responded to and helped to distribute the survey and who responded to the interview questions that we had. We just deeply appreciate all of the time that folks spent to provide feedback. So the hopes of the process evaluation were really to just understand what's going well, what have the challenges been, what are recommendations for change. And this last year, we were able to hear from hubs and families. We decided to hold off on incorporating partner perspectives due to competing timelines at the time, but we are hoping to be able to provide a partner survey this fall, and we will be inviting hubs to give us feedback or input on what would be the best questions to ask of the partners that you've been working with on coordinated enrollment. So just a quick overview of the different pieces of information that we were able to collect and how many folks we heard from. So for the self-assessment that was completed last spring by all 16 hubs, and all hubs were given the opportunity to collect family surveys last summer and early fall, and we were able to hear from 584 families. And then the interviews we had last fall with the hubs, we were able to talk with 13 hubs and 37 hub representatives and staff from those hubs. So those are the folks that we heard from. And some key overview of what we heard. Sorry, I'm trying to figure out how to, I can look at my notes and present at the same time. Okay, so we heard overall across the interviews, the family survey, that there needs to be a continuation of examining the equity processes in coordinated enrollment. So making sure that families have access to providers that meet their linguistic and cultural needs, and also being able to align timelines and processes so that we're really maximizing family choice when it comes to enrolling in early care. We heard that there is a need for clearer timelines and reporting guidelines for hubs, and a better alignment of data systems across program partners, including the data points that each programs are expected to report on and how those can be better aligned to create better data system alignment. In addition to clarifying the roles and expectations of the partners and the providers involved in coordinated enrollment, so everybody has a clear understanding of what the expectations are, and in addition to timelines, having those timelines aligned so that there really is a coordinated effort in enrollment when everybody's timelines are lining up. And just the need for more technical assistance and funding, more staff to provide timely technical assistance and funding to provide the proper execution of what coordinated enrollment is hoping to do requires a good amount of staff time and resources and expertise across data systems and marketing and things like that. So those are kind of the big picture of what we heard, and we're going to dive into more specifics. And so this next set of findings is from the self-assessment and the interviews. So what we heard is that coordinated enrollment partnerships are continuing to grow and be strengthened, that hubs have been able to leverage existing partnerships to aid in coordinated enrollment implementation. One example from a hub that we spoke with, they said that they alluded to having coordinated enrollment committees, and those are county-based. They have Head Start and their early childhood special education representative on staff, as well as school districts and other preschool promise providers as they're able to participate. As many of you know, if it's an in-home provider, even some of their center-based providers, it's really challenging for them to be able to participate in those meetings given capacity. But that's one approach that a hub has to creating those community partnerships. We definitely heard that it has been a challenge for larger hubs to really connect with all of the providers that and the partners that are involved in this work. You know, being able to provide resources and support for folks to be at the table. So, you know, this includes providers, but also partners that have, you know, a lot of other pieces of work on their plate. And so in order to facilitate partnerships, what's needed is a clear state system alignment between agencies like Child Care Resource and Referral, ODE, Preschool Promise, OPK, you know, at the state level, that alignment would help with the local system alignment. And again, just more clarity around expectations for what's supposed to be implied for partners who are being involved in this process and what those expectations are. So to streamline that work, again, having more clarification on the division of responsibility and requirement or goals of the CE work, and who is expected to do which pieces. In addition to what I've mentioned before, one thing that was recommended from a hub was, I think, including additional ELD program staff would be helpful in some of the meetings between partners, because there are a lot of times when questions have to be taken back to another department, and updates are not always communicated, and having additional individuals, additional programs, and additional departments involved would be helpful. Also echoing that keeping all of the answers in one place to questions that folks have, and really providing answers to everybody, all community partners, and being clear in communication that goes out, making sure everybody, hubs, partners, providers, receive the same communications would be helpful. In addition, again, expanding on what I mentioned before, so to timelines to maximize the family-centered approach and choice, that Preschool Promise should be able to recruit and enroll at the same time as other public programs. And I know that some of these recommendations that we heard ELD will be speaking to later, and that families, something that we heard from the family survey, which we'll get into more later, was families needing faster answers to questions about eligibility and the process of coordinated enrollment in terms of the different steps. You know, we know that hubs have worked to address these issues by, you know, having additional staff and additional flyers and visuals and things that will help families to understand more about the process. But in addition to having, you know, again, like I mentioned before, just additional staff at the ELD level to be able to provide all the technical assistance that's needed. And this is just a quote kind of reflecting, as I think most of you know, the timing of enrollment not matching Preschool Promise, with K-12 enrolling before Preschool Promise had a contract, and then hubs are being required to report enrollment, but that K-12 are not required to report their enrollment. and their enrollment is done 6 months ahead. And so they can't hold on to documentation that is needed for hubs that are required to have that documentation. And hubs don't want to ask parents for that documentation a second time. And so, working on aligning those timelines will just create a better flow for everyone. All right, so I'm going to go ahead and pause and give folks a chance to reflect on. I know I kind of zipped through those pieces, but curious if folks have thoughts of how those findings resonate with their community's experience. And I have a Jamboard that I could pull up, or we could have everyone drop their question or their responses in the chat. Since there's so many people, I don't know if a Jamboard would be able to facilitate everyone's responses.
Mackenzie, you want to try both? People could either Jamboard or put things in the chat. Chat.
That sounds good. So let me go ahead and share this link in the chat with folks. If you want to put it in there. So it looks like we had a question asking for us to speak to the lottery. One thing that we did hear from the evaluation side about the lottery is that this was a challenge for communities to feel like they were able to meet their highest priority need populations. But I'll let ELD speak to other maybe future things that are happening with the lottery.
Thank you. Yes, I know that that'll come shortly as we talk about our responses to the recommendations we had. Thank you, Maureen, for adding that.
Mackenzie, you're muted.
Thank you. Sounds like folks are finding that these are aligning with what they're seeing in their communities. Wondering if there's anything in addition that that folks would like to know or hear about for the evaluation in terms of partnerships and system work that that you would like the evaluation to focus on. Then I might move us along to the next piece of our presentation.
Looks like we have a question in the chat. Was there an analysis done statewide on how many children or percentage were under 100% of poverty and or pocket, and how that compared to OPK enrollment?
I believe that is something, and Catherine, jump in here. If you have thoughts, is something that could be looked at using the early learning map of Oregon data system that we've created for the preschool development grant, where you could look at those different pieces. There wasn't an analysis done for this piece of the project, but yeah, Catherine, curious what your thoughts are.
Yeah, I think it would be, I look to our partners at the ELD to know about the kids who actually got into the programs. I'll talk to you in just a second about the findings from the family survey. We didn't have those families report their income. We were more interested in what they were doing at each step of the process. But again, ELD has that data, I imagine, and Mackenzie's right. There is also the early learning map of Oregon could help pull up some of that data as well.
Looks like things in the chat have slowed down, so I'm going to go ahead and move us along unless anyone else has any key questions or thoughts based on what we heard from the hubs. And Catherine, if you just want to yell at me when you need me to change the slide,
Okay.
go ahead and.
I'll try not to yell. But hi, everyone. I am going to present the results from the family survey, which was a survey that was given out with the intent of finding out how families were experiencing the enrollment process. And I want to first give a big shout out to a number of the hubs, the Preschool Promise coordinators and other staff from the hubs formed an advisory committee with us to help us really think through the survey at the beginning of last year or in March, April, and helped us put it together. So thank you to them. And you'll see at the end, I'm going to ask folks if there are things that they can think of that they would like to add to this year's survey, because we'll be doing it again. But this was sent out to all the hubs to be given to any family who even just began the preschool enrollment process, the Preschool Promise enrollment process. So we wanted to get families who started to enroll and then opted out. We wanted to get families who went all the way, really to get a sense of what was driving opting out, what was driving going through the process, and what worked well for them and what didn't. We had 13 hubs who participated, and overall, across all their hubs, out of the families that they know that they had enrolled in the program versus the number of responses that they got, there was about a 25% overall response rate, which, isn't bad. It'd be great if it were higher, but it does give us a slice of a view of what the families were feeling. And we asked them about each step in the process. Would you go forward, Mackenzie, please? So, we had 548 families who gave us enough data to do any analyses with. Most of those were identified themselves as being the biological caregivers of the parent. 72% of them spoke English as their primary language, and 31% said they spoke Spanish. 12% of the parents identified their child as experiencing a developmental disability or a chronic medical need. And just looking at sort of geographics, we got about 3% of the responses were from frontier areas, 51% were from rural areas, and 46% were from urban areas. Next slide, please. And then this just gives you an idea. We asked the parents to identify the race or ethnicity of the child that they were looking to enroll. And you'll see how things broke down. Our biggest groups were folks who were Latino or Latina, those who had children who were white, and those who were multiracial. And then we did have a fair chunk of families who just chose not to respond to that question. I think that's always worth noting. Next slide, please. Then we asked families how they had found out about Preschool Promise, because we know that in the interviews and in the self-assessment, asking hubs about what you were doing or what they were doing to get the word out was one of the questions. And a lot of folks responded by, there's been a range of interesting ways that people have gotten the word out, one-pagers, flyers, etc. So interestingly, word of mouth is huge. That is the #1 way that folks are finding out about Preschool Promise, from a friend or a family member. The next biggest way is if they're being referred by another program or provider. So not Preschool Promise, but here in this group were places like Relief Nursery, my pediatrician, again, word of mouth being huge, and then also being referred by their preschool program or one of their preschool programs. So followed by things like social media, flyers and brochures. But again, what this says is that, getting the word out in the community has been extremely helpful in terms of recruitment into the programs. Next slide, please. So just in that first step of who even started the process by filling out an application, we found out that 98% of the people who were even starting the process went ahead, filled out the application. The biggest reason for not filling out an application when those parents who didn't do it were asked, was that they did not think they would be eligible for the program, income-wise. Then 91% of those 584 parents went ahead and turned in the required documents or information to determine eligibility. And people were particularly interested in the burden of turning in required documents and information, and how was that burdensome on parents? Why weren't parents doing this step? So next slide, please.
Just really quick, we had a question on the last slide about whether or not it's possible to get that information by hub region. And I believe the family survey was shared.
Yeah, it was sent. Yes, it is absolutely possible to get it by hub region. And every hub should have received your data from us. They were sent to hub directors and preschool promise coordinators if we knew who they were. If you haven't gotten it, please, let's talk at the end, because you are more than welcome to have your data.
Yeah,
I would love for people to be able to do it. Oh, hi, Scott.
Yeah, hi, Catherine. Sorry, if I could just clarify. So we did receive our individual hub region data. Thank you. And the reason I'm asking is that, let's say, so in our case, we did not do any radio ads, right? But could we see how effective radio ads were in hub regions where they did use radio ads? So it's not really maybe fair to say, oh, only a small percentage of families heard about it through radio if most hubs weren't doing radio ads. You see what I'm saying? So
absolutely.
Yeah. Is it possible to see among hubs that had a radio ad, how effective was it?
It would be if, and that's a really good point, Scott. Thank you for making that point. It is, that's what we're looking at families' experiences. And yes, if there was a region where they didn't do something, we don't know. We could do something like that if we could find out from hubs what they did do, which would be easy enough to probably do. And that is a good idea for the next round, is to ask hubs what they are doing so that we can do that kind of match.
Yeah, because that would just help maybe guide us toward the most effective outreach methods.
Absolutely. Good points. Thank you. Okay. So why families did not turn in documentation, and the biggest response category here was other. And most of the time, what parents would say is that they had a question about the information that they were supposed to respond or turn in, and they didn't get a response, or it took too long. So that's that 41%. And then again, there's another chunk of folks who didn't think that they would be eligible, so that they didn't turn their documentation in. About 8% didn't have the required documentation, and then others, decided not to do it, or there was other stuff going on. What I want to point out is that at the very bottom here, which I can't see on my screen, but I think it says that it was too, or is it? I guess the thing to point out is that there were smaller proportions of folks who didn't have the information, or felt like that asked for too much information, than there were who just didn't think that they would be eligible, or that didn't have the information they needed. And I think that had come up as a question about whether folks were sort of being scared off. What we don't have is any way to sort of parse this out by who said what in terms of groups, because it's a fairly small group of people. Next slide. In terms of being offered and accepting an actual spot, 78% of the folks who were filling out the survey were actually offered a spot, and most of them, 75% of them, accepted the spot, and that's 96% of the families who were offered a slot. The top 4 reasons for not accepting a spot were that the family was concerned about COVID, that they had already chosen, or they decided to choose a different childcare option other than preschool promise, that they didn't feel that the program was able to meet their child's health or other needs, and that they wanted a provider who was more specific to their family's cultural background. So if they weren't taking their slot, these were the 4 top reasons for not doing so. Then next slide. And then we asked families how satisfied they were with the program. And this is not a coordinated enrollment, right? This is the program that they were assigned to. But there was expressed interest in finding out, okay, once families get into the program, are they finding that it's a good fit, and that they like the program. And so of the families who enrolled in a program, 68%, so over half, said that there wouldn't be anything that they would change about the program. But when we drill down a little bit into what families would change, we found that there were definitely preferences that highlighted the needs for different kinds of families. So 62% of Spanish speakers said that they would change and make sure that and have providers who spoke their family's home language. 25% of families who had children who they identified as Latino or Latina said that they would want providers who offered a program that was more specific to their family's cultural background. And then 25% of families with children who had developmental or medical needs wished that they had providers who had more training in developmental and medical needs. So again, there were definitely, there's a great deal of satisfaction with the program, but highlighting that there are definitely groups that are feeling like their needs aren't being met. And those are around, to a large extent, cultural and linguistic responsiveness, as well as responsiveness to children's developmental and medical needs. Next slide, please. When we asked about satisfaction with the process overall, how satisfied were they with these 5 aspects? So the amount of documentation that had to be provided, the information, flyers, and materials, how the eligibility process was explained, how long it took for them to get answers to questions, and how long it took to find out if their child was eligible. You'll see that orange and yellow, or that yellowish green, are satisfied or very satisfied. And then that teal and that purple, folks are unsatisfied or very much so. And really, again, what comes out is sort of what Mackenzie was alluding to earlier, is that communication is always key, right? And so when families were dissatisfied, and I also want to point out that there is a high level of satisfaction going on here. I mean, you've got 80% or higher in most of these circumstances who are saying that the process was satisfying. But the biggest places where you found people who were feeling dissatisfied with the process, that was around how long it took to get answers to their questions and how long it took to find out if their child was eligible. Far fewer people were dissatisfied with the amount of documentation that had to be provided. And people in the mid-range were on information and flyers and how the eligibility process was explained. Next slide, please. Then we asked just free answer. So we just wanted to know what families felt worked well in the process. And then we took the answers and kind of coded them into these kinds of categories. And what we found was that families really, and this was true of just looking across answers, families really appreciated the ease of being able to complete those applications online and be able to upload their forms, the documentation for eligibility, just do it right there online. The second most mentioned thing that worked well in the process was good communication and help from the hub staff. There were lots of families who commented on how, they felt like they could ask any question and get an answer, that the hub staff communication was very timely, that they felt listened to, that they felt heard, and that they could get answers. It was followed by satisfaction with the program in which they were placed. Then sort of just general satisfaction, it was all good. Timeliness, there were some people who were dissatisfied, who said nothing satisfied them. We'll see them in the other slide. And then there were a variety of things, others that didn't really fit into those categories. But again, by far, it was the ease of the application and the hub staff that were the big winners in the process. Next slide, please.
Really quick, Catherine, we had a question on
sorry.
The last slide, I think, asking if we asked for those families who were not offered a spot, why they were not offered a spot.
We did not ask them why they were not offered a spot. I think because we didn't know if they would know. But again, we would be really interested in hearing if that was something that you guys would want us to ask, if they knew. I think it's definitely something we could add to the survey in the future. Thanks, Mackenzie. And then the next slide. And then we asked finally what would improve the process. And again, I want to point out that almost half, right? 47% of folks were satisfied with the process as it was. That's a good chunk. And then, the things that they would change are having better communication from hub staff once the process is started. And I think that refers to some extent to that idea about getting answers to questions or knowing about eligibility faster that we saw in the other slide. A better, quicker timeline, clarity around the eligibility, the process or the actual programs involved. Then some proportion of folks would want more options or slots for care. So a number of families mentioned wanting infant or toddler care or having before or after school care and transportation. There were, in spite of the fact that on our last slide, we saw the good 40% of folks liked having the application online. There were definitely some families who said they'd rather have another way of doing it. And then there were some families who would like expansion of those eligibility guidelines. So to families with either higher incomes or other age groups, again, kind of matching into that need or that desire for having before and after school care. And then a group, and I'm sorry, I can't see it on my screen, so I can't tell you the percentage, but who would want fewer or different requirements. 2.4. Thank you, Sky. So a small group that would want fewer different requirements. But again, I think this does speak to a concern that we heard from quite a few people when we were talking about this, about the burden on families in terms of requirements. And so that was the least mentioned, again, only though by the people who filled out the survey.
Catherine, it looks like we have
yeah.
another question.
From Athena.
Yeah,
I see it. Thank you, Laura. It just popped up on my screen. There wasn't anything very much that parents said about the lottery in the comments. Where would I have put that? I think it might have come into the clarity around eligibility, but again, I read all the comments and there really wasn't very much mentioned in there. I see a hand.
Am I the only one? Okay.
I think so, yes.
Okay, great. This is Begoña with Washington County. I'm a little bit confused about the statement about better communication, because sometimes it seems to be positive, sometimes not so positive. So I wonder if the difference is between those families that the answer is coming from those that have not been placed, and then the second set of answers is for those that were placed. But my question is around when they feel that there was no communication or lack of follow-up, what are they really saying? Are they saying that once they submit the application, we don't follow up with them, we don't answer questions? Or are they saying from the moment that we are clearly indicating that we are only collecting applications, but we are not working on eligibility, but there is a disclaimer that says we are just accepting applications, but we are not doing placements until this date? Is that gap of 1 to 3 months until we are allowed to actually go ahead? Is that what is getting on the way, or there is a little bit of everything, or there is nothing?
I think that's a really good question, and I'm not sure we can really break it down from this data. I think that there might be ways to break it down in the next survey, and I think we should definitely talk about that. Just sort of from just reading over the parent answers, I think now that you talk about a gap like that in which you can't talk to the parents, you know, there does seem to be, I would wonder if that wasn't some of it, because you know, there was that sense about, I need to know this better or quicker timeline, I guess, is also falls into that, is that, you know, I need to know if my child's going to go to this place so that I can make a decision about another place. So,
right, that's exactly what I mean, that even if there were disclaimers, I'm expecting that you will get back to me in 1 week or 2 weeks, but not 2 months later, right? With the answer.
No, I think that that's a really good point. Thank you for pointing that out. And yeah, and I think, you know, you say, and you made the good point, right? That on the last slide, there were a lot of people who were really satisfied with the communication. And then here's this sort of seemingly exact opposite thing. And I think that, you know, we do see that with surveys, is that people have the same, you know, they'll flip-flop it. But I do, again, from having read the comments, you know, the sense was that when staff were in contact, people were very satisfied with the types of communications and the help that they were receiving. So again, I do wonder whether there is something going on with this gap that you talk about, for sure.
Well, and just a related comment, remind me, Catherine, because it's been a while since I looked at our survey results. When we ask parents what would improve the process, are we only asking those parents who actually completed the process and were offered a spot, or are we asking all?
We're asking everybody.
Okay, so
Yeah.
that could also help explain it, because, you know, if I'm a family that ultimately was found ineligible or was not offered a spot, or there was no match, you know, I can totally understand that family being frustrated and wishing that there had been more communication up front to save me the trouble of going through the process.
Yeah, I think that that is a good point. And remember that a good chunk of these families were in fact offered slots. So, you know, you're getting both views for sure. And there was
one question,
yeah,
that we had, Catherine, was about being able to see this data broken down by different priority populations, to see if there are certain priority populations that, you know, potentially are reporting communication issues versus others.
Absolutely. And that's a really good question. I saw that slide by. Yes, if you look at the report, the big report, and I think the link came, I think, in the email with the link to this meeting, and I think we will give it again. I think it's at the end of this slideshow. Yes, the data are broken down by race, ethnicity of the child, family, primary language, region, and I believe that might be it. But so it may not be broken down by all the priority populations, but it is broken down a little bit more, and there are some differences, and they're definitely worth looking at. with the coda and the caveat that, you know, some of those groups were really small. So as a researcher, I must always remind everybody that small samples may not be taken completely. I mean, you know, you just have to realize you have small samples, but yeah, they are broken out. And I think that would answer some of your question, Michelle. Okay. Anybody else? I'm sorry, I can't see your boxes. Okay, great. So our next group question that we would like to pose to you guys is to, and thank you, Toby, that's a really good question. And I think that our ELD partners will address that. Yeah, question that we'd like to pose to you, and I think maybe we'll do the chat because you guys seem to be really quick on the chat, and that would be a good place to capture this, is knowing what you have seen from the survey that we've talked about and how we sort of proceeded step by step, and what, you know, what stopped people, what would they like to see changed. What else would you like to know? Because we're going to do this survey again this year. And it is only useful to us if it is useful to you. And so what other questions might you like to ask? And you can also, yeah, talk out.
I would like a question about if the families are satisfied with the communication with the providers in terms of like, do they get a progress report? Do they have a really good partnership with, is there a good partnership with providers? Are they a team?
Okay.
Yeah.
Okay. Sorry, I'm trying to scribble stuff down, but I will look to see. The other thing that I've seen a couple questions float by, and I will admit to not having followed it, but everybody, all the hubs were given their data back from the family survey, your own personal data for your hub, and we would do that again in the future. So again, like I said, think about things that you would like to see the answers to.
I have a question.
Uh-huh.
I'm wondering, you know, taking a look at really what do families need in order to make an informed choice, and how could we be providing education to parents on what quality care looks like, so that they can understand what is normal. In addition to that, what are the options that they have? Not everybody has the option to have a particular time frame and somebody to pick up the child for the remainder of the day. So how are we continuing supporting those families who have not been able to fit themselves into a publicly funded program? And, you know, really taking a look at how could we better support parents in that regard, and make the education piece a part of that. And yes, that includes more staff. Yes, that includes more support. But I think if as a statewide, and something we could do statewide is to help educate parents on what quality childcare looks like. I have worked with so many families in the history of my career with childcare resource and referral, and well-educated individuals do not understand what quality childcare looks like and what it means. So I think that that's essential for us not to forget the education to parents.
Thank you. I'm seeing sort of on that note, I'm seeing questions about, right, what are the gaps in service that Preschool Promise is not meeting? Also interest in finding out what other programs families applied to. And do they understand what other choices they have? those are all good questions.
Catherine, it looks like we have some hands up.
Okay, sorry, go,
It looks like
let me see.
Michelle.
If I can, Michelle, go ahead.
Sure. And this might not fit perfectly within this type of family survey, so feel free to be like, no, that doesn't really fit with what we're trying to discover. But our hub is really curious about the level of education or understanding around the benefits of preschool, because we're wondering if really we should be putting a lot more energy into educating and promoting that kind of information as kind of a foundation to get folks interested in Preschool Promise. Like, hey, do you know the benefits of preschool? Because if you don't, like, you might think it's just babysitting, right? You might not know the life outcomes that it makes better for multi-generational. So just curious about adding something like that.
Yeah, that and that ties back, I think, to the earlier comment about quality and understanding quality. And I think those are really good questions. And remember that these are people who are already applying for this, so they see some value in it. But I do think it would be interesting to know their reasons for sure about, you know, what value they're seeing. Begonia, you have your hand up.
Just really quick on that, Catherine, I wonder if that might be a better question for if we do another household survey.
That's a good
get
point.
A larger view of families across the state, not just those that are involved in coordinated enrollment.
Or both.
Yeah.
I'm seeing a lot. I think from what I'm seeing flash across is extra services above and beyond Preschool Promise, transportation, things like that. And I think some of that came up right in the comments about what they would change about their program. So we did see some of that wanting, you know, larger ranges of care, larger age ranges. But those, you know, those are things that we could definitely ask some more specifics around, or specifically to find out how many people endorse those. Okay. So we'll take this information. Mackenzie is going to talk about the timeline in a little bit, but you know, if you come up in the dead of night, you wake up at 2 a.m. and go, oh, I should have put that in the chat box. I really need to know this. It is not too late. We're going to be working on this for several months now before we actually put it out. So if you have other things, our information is going to be at the end of the slideshow, or you could send it to Anne or anybody at ELD and they can send it to us too. And I think somebody's making the comment about it seems very Preschool Promise heavy. And again, I think we're going to widen the lens this year. Last year, we were sort of under a timeline to just be looking, you know, so that we really ended up mostly looking at Preschool Promise. But yes, there's definitely the desire and the intent to widen it out and find out what folks are doing in terms of other programming besides Preschool Promise, for sure. Thank you for those suggestions. Super helpful. So, oh, go ahead, Mackenzie.
Yeah, I think we had this time set aside for us to kind of split off into small groups to talk about how you and your partners could incorporate these findings into future work. And I think, Anne, you're going to help us with the small group discussion groups.
I am, and just so everyone knows, we weren't exactly sure what our RSVP situation looks like, so I hope you will forgive me if we have you all in somewhat random groups. Maybe take a moment and introduce yourselves if you're coming from different regions and partners, but we'll split you off here now. And I believe I will open all these in just a moment and you will be whisked away, but let me know if you need any help. All right, and presenters, I think it has added you to rooms. Just feel free to ignore that invite if you'd like to stay out here for the conversation.
Thank you, Laura.
Let's see, Annie and Julie, can I help you get into your rooms? Are you seeing the invitation? Oh, and I think maybe Cheryl as well. Oh, Annie made it. How about Julie or Cheryl? Are you seeing an invitation? I'm trying to resend you all one.
Or if they might have just stepped away. They're gonna come back
in
in.
too. Yeah. Take the invitation for a break.
Thanks, Anne.
Yeah, sure thing.
Are you thinking, Anne, that we would bring back together that same advisory group? I mean, we haven't really talked about it yet because we haven't talked so much about the family enrollment survey, but I mean, the family survey, but I wonder about doing that again.
Yeah. Yeah, I think having an advisory to go over, especially with all the new, like, more in-depth questions
Mhm.
too. Yeah, I think a similar process makes sense.
Hey, I just had to hop on my phone, and so I had got like exited out of my breakout, and now I'm with you guys. Can you put me back in my breakout? Or
I can. Did you happen to catch which room number or who you were with? Somebody?
I don't remember the room number. I was with Noemi.
Okay, let me.
Sorry to crash into your group. And
you are fine. I think I found you. It's number 4. So that's
thank you.
Sure thing. 924. There we go. You should get the invite now, Taya. Cool.
Yeah, I do think it'd be nice to, I don't know if I don't even know if it would necessarily have to be the same players, but just to, again, like, how do we measure not killing the families?
Yeah,
it's a lot of information.
Yeah.
But how do we how do we get some more of that information?
Mm-hmm.
this is what like our third conversation in the last week internally, where we're like, so sometimes when we get families, we want to ask them all the questions that we can. Like, okay, we have to prioritize. We can't ask every question that we have every time. No, it's a tough one though, because it's like a lot of the questions that people brought up, I was like, that would be really insightful. Like, it would be really great to know what you liked best of your program rather, but then it's like that gets into like a program evaluation. Like,
Right.
I mean,
Welcome back, everyone. I'm sorry if your discussions, your small group discussions were cut off. We're gonna move along, but I hope you had a good discussion. I know the discussion I was in was really great to hear everybody's perspectives, and got some good feedback for the future of the process evaluation this year. So we're going to transition into hearing from early learning division, but folks, feel free to continue to use the chat if there were thoughts that you got cut off in your discussion or didn't get a chance to share. I think, Carmen, you're up, or is there someone else from, and if you want to let me know when I need to change the slide.
that's great. Thank you. I'm checking to see if, oh, Dana is here. Great. Great. Well, hi again, everyone. I know a few people joined us late. If I haven't gotten to meet you in the past, my name is Carmen Ellis, and I am the Community Systems Director at the Early Learning Division. And I'm going to be co-presenting on the work that we're doing around the recommendations from this report, or evaluation report, with Dana Jung. So Dana, do you want to introduce yourself?
Good afternoon. My name is Dana Young. I'm the Preschool Promise Program Manager here in our program unit at the division. Thank you.
Okay. So yeah, as I said earlier, thanks everyone for being here today. It's been a really good conversation, and we had a great conversation about your comments and recommendations while people were in the breakout groups. The facilitators were hanging out and mulling over what you said, and it's just so fruitful for us to be in community with you and hearing about your experiences and what could make things better for you. So appreciate you taking time out of your schedule to be with us. We, at this point, the recommendation work that we've been doing is in progress. So I just want to be clear with people that Dina and I will not be presenting like the full scope of everything that's going to happen. We are working across our teams internally to go through the recommendations one by one, and have received those recommendations with suggested prioritization levels as well. So part of the work that we're doing is going through, looking at all of the recommendations one by one, considering how they fit into our current goals, our current staffing levels, and just trying to really understand across teams what that would look like and how the recommendations can be made to fit into the implementation plans of our various programs. Because as was stated earlier, it isn't just Preschool Promise, there are other programs to consider as well. So that's a bit of a complicated process. It's been really fruitful conversation, so I'm excited to come to the end of that. But I do want to just stress to everyone that we're not going to be able to give you a full preview of how recommendations will be implemented at this point, but we do want to bring you in on some of the work that we've done so far. So as I said, we're reviewing the recommendations across our internal teams, and those teams that are primarily involved in that conversation are the program unit, where Dana sits, Community Systems team, which I direct, and then Grants and Operations, which is under Teresa Waite at this time. And that Community Systems team is co-managed by John Reeves, who heads our professional learning team. So they're also part of the conversation. So this work involves coming to agreement across teams about what the priority levels, as well as I was saying, what our staffing considerations are, both internally and externally, considering what it is that we fund to happen in community. Okay, next slide. excuse me. So one of the recommendations that we received was to increase the capacity on our program team during those peak enrollment times for responding to eligibility questions. Eligibility questions there's not just like a script that you can have in order to just, okay, you need this, easy flow chart, one and done, on to the next call. It really is pretty time consuming and it's complex, and you want to make sure that you get the answers right. So we're looking at that. At this time, we think that the one full FTE that we have assigned to that for the enrollment period coming up will likely be more or less sufficient, but we're making a backup plan right now to start bringing on other staff and training them and onboarding them to the process in the case that we do need to bring in extra people, which last year that person was brand new who's providing that. So this, I am hopeful, will be a vast improvement to have really a lot of support. And then reviewing the process of approving program unit enrollment responses. Same thing, we're looking at how we use our FTE internally to do that and making a plan of how to be more responsive. Okay, next slide. Okay, so here's a recommendation that's in progress that we agree is a high priority. And I will say that in the work that we've done so far in reviewing the recommendations, there haven't been any where we disagreed that it should be a priority, and there haven't been any recommendations at all that we questioned. They all have made really great sense, and we've agreed with the priority level on them. So just wanted to clarify that. So the selection processes and priorities. Dina, did you want to speak to this one?
Yeah, I can go ahead and take over. So one of the priorities that's currently in progress for this program year is the selection process and priorities driven really by local development by our early learning partners. So that is one thing. In previous program years, like we had our lottery. So, and we know that there's different ways by which prioritization can go ahead and really happen. So we've been doing a lot of collaboration with DOJ and getting their counsel as far as like, well, what does that look like, and how can we go ahead and kind of put more local development and really just allow for that. So we'll be sending out to all of our early learning hubs within the next day or two the selection priority process, which will allow hubs to go ahead and just prioritize by working with their partners. And it will also go ahead and allow hubs to continue or not do the lottery. They may decide to go ahead and do a different method, which is, that was super important for us to go ahead and allow for that local development. Next slide. Another thing is we're looking for expansion in our RFA. We've been in talks in collaboration with our procurement department as far as like how can we go ahead and get local input as far as like, and I can only speak for like Preschool Promise as far as what that allocation looks like in community, and really just focusing a lot on parent needs, like what is it that they're looking for in a preschool program. So we have started, we requested, and thank you to all the hubs. I know that we put you guys in a pretty short timeline to go ahead and submit your slot allocation assessment and be able to inform that. So we are working with our procurement department. How do we embed that in our RFA to then be able to inform like selection for our expansion? So that is still in the works, but that is a high priority for us. As far as when for those of you that are wondering, where is that RFA going to be launched? The day is spring of 2022. That's still the day that we have been provided by procurement. Next slide.
Dina, sorry, can you repeat the date again?
Spring 2022. So we don't have an exact day. All we know is that it's in the spring.
Okay.
Yeah. The other thing that we've been working really, we've been doing a lot of work is really with the PSB enrollment manual. So this is the manual that really kind of goes through the process on how do you do eligibility, selection, and placement into Preschool Promise size. So kudos to Crystal. She's been working really hard and collaborating with coordinator coordinated enrollment specialists as well as the OPK, some of our URSA specialists to go ahead and get some feedback on how to improve some of those processes. So that is another high priority of getting that out, as well as all the supporting documents like the preschool promise application and other supplemental forms there. Our goal is to still go ahead and release our preschool promise application in all 5 languages. So that also, sometimes it poses just a little bit of a delay in our release, but that is a commitment that we have, is that we release that information in 5 languages. Next slide. So this one is, I think this is the dream. It's like, how do we align our awarding timeline and being able to release like who are those preschool promise grantees and really align with our enrollment and recruitment processes locally. So that is a future. I mean, that's always in the works as far as like, how do we align that? So then as publicly funded programs start doing some recruitment and some outreach to families, then we are able to go ahead and also award grants in a timely fashion. So one thing that we have heard from grantees is that it is really, once you get to those months of like March and April, as you start getting, families are starting to ask, am I going to go ahead and have preschool promise next program year? Am I still going to be able to hire this staff that we have? So one thing that we're really looking at in the future is to go ahead and do multi-year grants. Right now, all of our preschool promise grants are only for 1 year. So we're hoping to go ahead and be able to provide more than the 1 year and go into a multi-level type of grant, which will allow for families to go ahead and know whether they're going to go ahead and continue with that specific provider or not. This is high priority. It's going to be a lot of work. We have started like for this program year, for those of you that joined our preschool promise grantee Q&A session, we shared with our grantees last week that we are not, our intent is not to do a full on continuation application for our grantees. We're looking right now to go ahead and do some grant amendments. But right now we're still working to as far as like identifying like what is the threshold for continuation for our current grantees. So we're really trying to look at our processes and just identify how can we make them more lean, more informative, and that will go ahead and allow our hubs to go ahead and know how many slots do I need to fill, who are the preschool promise grantees for next program year. And I just want to go ahead and emphasize, I'm only speaking about continuation. We know that with the RFA, that's a full-on body of work. I know that there was some hands up, so I believe Sky, you have a question?
Yeah, just going back to the selection priority guidance, when you say that's coming out in a couple of days, is that both the statewide priorities as well as guidance on developing regional selection priorities? Is it one or the other? Just wondering.
It's both.
Okay.
It will be both. Yes.
Okay.
Thank you. Great question. And Michelle?
Hey, Dana, you mentioned working to release the enrollment manual and application pieces, all the appendixes in the 5 languages, and how that might take some more time. Are we still looking at a March 18th as that coming out, or is that date now pushed back some?
I don't want to put our friend Crystal on the spot. She will have the exact day. I apologize. I have so many deadlines in my little head. Crystal, I don't even know if she's still there.
Yeah, I'm here. So yeah, I think we are still anticipating the March 18th date. If for some reason that changes in the next week or so, I'm sure we'll be giving you all a heads up before that happens.
And I don't see any other hands up, so I'm gonna go ahead and turn it over to Carmen.
I'm on mute. That's the 3rd time today doing it. Next slide, please. Thank you. So another high priority, this one is already in progress. Oh, sorry, I think we got
Yep.
over. Dana, will you do this one too?
Yep. No, that one's mine too. Sorry about that.
No, you're
So
fine.
another thing that we're doing, obviously, with our preschool promise program is really just looking at our reporting system. So like the reports that we get from our hubs and the reports that we get from our grantees. Over the past year, where we see some feedback from our hubs as far as like, hey, how can we go ahead and help support some of our grantees and just reducing some of those reporting requirements that we have, or being a little bit more intentional also from our CCR and ours. It's like, we're getting questions about like, why are you getting this information and this data from this party, but not this party, and vice versa. So that's one thing that we are working currently with our data gurus here at the state. Is like, how do we align that data to go ahead and like reduce some of the burden on reporting, especially for some of our smaller grantees. So more to come on that. I mean, that is always in development, but we're looking to go ahead and make some improvements for next program year. Now I'll turn it over to Carmen. Go ahead.
Great, thanks, Dana. So got more of this alignment and coordination of our priorities. And this is really ongoing work that is happening across all of our programs already. So I guess this could really say in progress as well. But aligning selection priorities, our eligibility limits, and the documentation that we require from families across ELD programs. I really want to make sure that we get some continuity on that for families so that we're not having different expectations for what you would present for one program versus another, particularly if you've already been like accepted into one program and then you're looking at another one that you would have to pull out another set of documentation. It doesn't really make sense. So we're working together across our programs to come to alignment. And wanted to especially call out, though, that we are needing to work from the understanding that OPK and Head Start eligibility requirements are set federally, not locally at the state level. So we need to make sure that we're in line with that, which is actually really helpful because we are able to learn from OPK and Head Start who have so much experience in successfully running eligibility and enrollment. So that's not a barrier. It's just something to keep in mind for all of us as we're moving forward. Yeah, wanting to be clear that we're not expecting OPK or Head Start to make changes, but rather to work within that scope. Next slide, please. Thank you. So high priority for this year that we're in right now in 22-23, just continuing to share information on coordinated enrollment and to communicate with all of our systems partners together. The recommendation that we received specifically named Early Learning Hubs, CCR&Rs, Head Start, and OPKs received communication at the same time. And we are adding, in our minds, early intervention and early childhood special education to that list of community partners that we'd really like to be sharing out with. We hear both at the state level and then from local level from our ESD partners that they are, at this point, we're needing to integrate more fully and make sure that they are also receiving information about how the coordinated enrollment system, the timing of it, when families can expect to receive information, so that they can be part of those conversations as well. And then also bringing them into conversation with our coordinated enrollment staff to make sure that we want to make sure that children who are or families who are experiencing a disability, that there's a strong connection if they're already receiving services when they're enrolled into a different publicly funded program or when they're enrolled into a publicly funded program at the same time. So we are going to be working to make sure that we're supporting both the EIACSC and the coordinated enrollment staff to do that. So you can look for some future communication on that. And then just working to further clarify our expectations of which partners out in the field are doing what and how those system partners work together. A lot of that happens on a local level, especially with hub facilitated conversation amongst partners. So I don't mean to say that we would step in and dictate how that is, but we are aware that there needs to be more clarity that goes out to all of the partners about what we expect from everyone with the funding that we're providing. Begonia.
Carmen, can you be more clear about when you say there's going to be, you will send a communication out and the support for the relationship to the hubs and the ESD? Can you be more clear about what you mean by that?
Sure.
Is this like a funding thing? Is this like a what exactly?
Yeah, no, I'm happy to do that. And this again is something that's very much in progress. So I don't want to say like, I can't give the full scope of that, but I know as community systems director that there are hubs that have very clear communication already established with their EIUCSE partners in terms of, hey, if we receive an application from a child and they have an IFSP, we know that we need to communicate over to our to the preschool promise provider, for example, who is going to enroll that child, that services, in order for services to continue, like say they have a speech path coming, in order for that to continue, that preschool promise provider needs to have it flagged for them. Hey, there's a child coming in who has this IFSP, and you'll need to meet with their speech path and the parents to go over that IFSP so that the child can continue to have those services with as little interruption as possible. And there are some regions that already have that system worked out, and there's other regions that are still developing that. And there may be people who are not preschool promise providers or other publicly funded providers who aren't aware yet that there could be an interruption of services if they don't respond right away to those requests. So just making sure that's a great, like an example of that communication that needs to happen, right? Is we can't expect that people will know these things. And that's one of the things that we've highlighted is, hey, some people have figured out locally how this is going to work. And others, we need to make sure that they are moving forward in those conversations and understand what needs to come out of them.
So
Yeah,
Carmen, definitely that's not what I was expecting to hear probably. So at this point, in many of our regions, we have a waiting time of a couple of months just to do the assessment, not even to trigger the support system. And now we're about to double the capacity of preschool promise, which it means a significant number of children that will be screened. And the capacity for the ESDs to support this thing at this point might not be there. So how do we approach this thing when the need is high, the support system is not at the same level, and then we're gonna double the offer?
Yeah, I'm not actually talking about screening. I'm talking about the role of coordinated enrollment staff at the hub in helping to facilitate continuation of services for children who already have services through EIUCSE. So not facilitating the screening, but if you receive an application from a family who says we are interested in exploring what we have in like locally in Head Start and Preschool Promise, like what's there, and then through that process, they're like, okay, we've chosen this program, and you learn from the family that the child already has an IFSP and is receiving services. That part of somewhere in there, it needs to be clearly communicated between the family, the new provider, and EIUCSE. Hey, EIUCSE, this child is moving. You've been visiting them at their current site, and they're going to a new site. So the conversation needs to happen with the family and the provider to talk about what needs to happen at the new site. And right now, not all providers understand that not having that conversation is expected, and that not having it actually interrupts the child's access to services, which is a right that they have. And that isn't that provider has any intention of doing that. It's something that we've flagged that we need to make clear in community. And that if there isn't an understanding of that or an agreement about how that happens, that we need to work with our regional partners and our state EIUCSE as well to make sure that we're giving people the support that they need. Is that more clear, Begonia?
It is more clear, but still it comes back to us.
I just have to comment. I just feel like we've been doing this, I don't know, Jillian and I, for many, many years. And I don't mean to be critical, but I think you need to hear this, that this is, I feel very much like the tail is wagging the dog, that PSPs should have been put into a biennium funding cycle before this expansion came out. The beginning of this meeting went really well. And when you started to talk about lotteries continuing and then I realized, oh, it's because of the funding cycle. And I thought, why didn't the state move towards making them a biennial so that then they could change their grant manual to allow them to start doing coordinated enrollment with Head Start this year? I'm frustrated. I know that there's a big expansion up there and that you're hiring new people, but that should have been taken in consideration way before this. And the second comment on the transitions, Head Start has been doing transitions with ECSE for as long as I've been here and longer, and we're experts at it. And we could help at a local level. There's so much that we can do at a local level if you would just cut the strings and make it so that we can work together. And we won't be able to work together on coordination until the biennial funding cycle changes for them. And then there's a clear expectation of MOUs between hubs and other partners to work side by side. And that's not going to happen this year, evidently. So I'm a little frustrated.
This is Dana, and I want to go ahead and clarify something because maybe I was not very clear. So as far as the selection and prioritization, the guidance is going to say is going to allow the hubs whether they want to go ahead and continue or not the lottery system. We know that there's different methods, so that's not the ELD saying that lotteries will continue. It really just gives the flexibility to the early learning hubs to decide what method of prioritization will work best for them. That may include the lottery. They may decide like, no, I don't want to do this. I want to go ahead and do a different method. So and I apologize. I know it's taking a little bit longer for us to go ahead and get that guidance out. We needed to go ahead and go through the OJ and just verify, but I do want to just go ahead and point it out, like the lottery is going to be more of a local choice, whether hubs want to continue doing that or they want to go ahead and implement a new method for prioritization. So. And Carmen, I wasn't sure if you were gonna address.
No, I totally understand, Maureen. It would be so much simpler right now if they were on that 2-year cycle already. I agree with that. As for the coordination that Head Start has with ECSE, that's actually what we're looking to model after and looking to use the MOUs that Head Starts have and to offer them as a model to those that don't have that. So that doesn't solve everything, but I do want you to know that like we see you doing that and know that that's a system that has been working for years and years. So not looking to replicate that or to ask for Head Start to do something different, but to take the way that you've done it and even the wording and the documents and MOUs and be able to offer them to others in the system who have not developed that yet. And then there's a question, Dana, for you in the chat from Darcy and Clackamas. When you say hubs will decide the priorities, do you mean the hub staff will decide or that this would be a conversation with the hub governance?
Great question. This will be through the regional stewardship committee. So there will be some information, definitely lots of collaboration. And then also like, just going back to like the hub, right? So who do we consider like the hub is really their local partners in collaboration with parents and other entities. And I don't know if you want to expand on the regional stewardship involvement there.
No, you got it. Just for those who might use different terms, you know, it's the body that includes Head Starts, often includes EIA, CSE, and CCRNRs as well in making plans for coordinated enrollment. So from your sector plans to our slot allocation assessments, really trying to build out that really overarching cross programs at a local level planning team or committee to make that happen.
Go ahead, Darcy.
Yeah, so I guess I just want to dive into that a little bit more. So regional stewardship, I have to be honest, that's not a term that I'm familiar with, and I am the Head Start and Healthy Families entity in my hub area. So I guess I'm curious what that might look like. And when you say sector plan, as far as I know, the work that was done in the fall of 2019, which we all know things have changed a little bit since then. That was the last real data analysis that's been done. There was a really fast meeting that was announced like the day before where we basically had to just rubber stamp something that was put together by the staff in our area. I'm just curious, I'm just going to be completely honest. It feels like there's a lot of talk about collaboration, but there's not any, I guess I'm curious, like if there's not an expectation that it will be on an agenda, there will be these people at the table, then what is the accountability for that? And how do you ensure that that collaboration is happening? And I'm also curious, why do we have a hub and then we also have a regional stewardship committee? And it just feels kind of fragmented, honestly.
Let me speak to that really quickly, and then I'm going to let Dina or Anne or both address that. So Darcy, I think you just put your finger on a constant problem that I have with words around our early learning system, is that often when people say the hub, what they're talking about is like the hub staff, or sometimes even just like the hub director. But there's another usage of hub that's like the hub and like all of their governance and like all of their partners even. And so when we're talking about in this conversation, the hub making the decision, our intention is really that regional stewardship committee is one of the hub committees, like the largest one of them, that these decisions would be made with the big hub, maybe we could say, that does include a variety of providers and has parents involved. And I also recognize that when the timeline from when something guidance comes out to when it's due is short, that it does exclude people from the conversation because it takes time to bring people into space to have true collaboration.
I guess for me, when I'm being held accountable for having some sort of conversation from my funding sources, I have to show that it's on an agenda and there was conversation about it in the minutes. And so I'm curious about getting that specific because people can say, yeah, there was a conversation, but if you have it, first of all, if there were actual minutes required, that seems important to me, as well as having a clear agenda where, yes, this was the agenda topic and this was the conversation that happened. Just food for thought.
For sure. And I think that as hub members that you like, some of this can come from ELD guidance on like what's in a contract to hubs, but also like as hub members that you're also welcome to push that like on your committees, is to say like, I would really like for there to be minutes. I would feel like I was being more accountable to my community if there were minutes, or if we did have different roles like that. That is flexibility that exists locally. So that's sort of a shared ownership there. Dina and Anne, did you want to speak to any of that?
I think you covered it, and just to acknowledge, because I'm seeing in the chat too, I think consistency in words, who's deciding what these groups are called, and also that in order for successful collaboration and communication to take place, like we need the time, and that has been something this year that's been very rushed and leads to those things, Darcy, like you're saying, like rubber stamping as opposed to really digging in and getting there. So when we talk about the recommendations that come out of this evaluation, including timelines, we're also including how we give all of you all as partners the time that it takes to really plan together and come together, so it doesn't have that feeling. But acknowledge I see this in the chat too, that the timing and the ability to have a meaningful discussion and conversation and come to a community decision, we haven't had that timing, and we're seeking to improve that too.
No, the only thing that I would add, Carmen, just to the group is Marie, we totally hear you as far as, the length of the grant. So we're really looking to go and say, how do we extend it to a multi-year, especially for some of our small entities, and really all of them, it just causes a lot of stress for like staff. And so know that we are really working really closely with our procurement on how do we fix that and how do we make it better. I think for Preschool Promise, because I only speak for Preschool Promise, because we have other publicly funded programs, is like how do we, this was her, last year was her first time like granting with the state, so we ended up with just 1 year, but it's like we really are working with our grants and ops and procurement department to really just expand that. We know that it's going to go ahead and improve a lot of our systems, and then really at the end of the day, just I think about just it's going to go ahead and reduce anxieties with families. Often we get lots of questions from families. Am I going to continue with this teacher? What's going to happen to my Preschool Promise program? So I hear that we're working diligently to go ahead and get that fixed. Thank you.
And I see a question from Begonia that says, that's asking what the increase in funding would be for carrying out this work. And I don't have the number for that. That's part of the conversation that's still happening. Okay, really quickly, next slide. Great. So a priority that will continue to be high priority, and that is in progress. That was one of the recommendations, is to continue partnership meetings about coordinated enrollment with early learning hubs and Head Start and OPKs. And we have notes on recommendations that we received in the meetings that we've attended so far, and are also working to implement to see how those could be implemented and overlaid in coordinated enrollment work and in Preschool Promise enrollment in particular. Next slide. Yeah, this is another big one that's also already in progress. That was a recommendation, was to work with ODHS to get access to the one eligibility system. I see Sky, yes, please. Yeah, we are in conversation with ODHS about how we can do that and what kinds of, what we would need to have that access, because that really is a service for families that we're looking to provide, is being able, yeah, exactly, better for us and better for families. Yeah, it's time for that continuity to happen. So will remain a priority until we can get to that. And I think that might be our last slide. Next slide. Oh, okay, next steps. We're going to continue to review the evaluation report recommendations, and happy to set up time to check back in with people when we've had time to move through the rest of the recommendations, if that would be helpful.
Great, thank you so much for being able to share what the Early Learning Division is doing in response to recommendations. It's a new process that we've been starting to do between the evaluation team and ELD, which has been super exciting to see to see, yeah, how those recommendations are being incorporated. So, so just really quickly wanted to show a snapshot of kind of what we're thinking for this year. And please in the chat, if you have anything that's any feedback on timing of when we're thinking about the evaluation team is thinking about doing these things, like definitely let us know. So we're hoping to start this month on, and I think this meeting was a great kickoff to getting some feedback on how we can change our survey to families to better meet the needs of you all. And so we'll be working on finalizing that, you know, probably in May, I would guess, and then we can start data collection. And yeah, hearing that, Sky, for pushing back data collection or continuing data collection. I think last year we continued through October. And so that might be, you know, something we could do again this year. Is extending that data collection timeline. And then for the self-assessments, we'll be taking a look at those in August and September and creating just a brief report or comprehensive report for ELD. And then we'll, you know, incorporate that into our final report in December. And then we're hoping to do the partner survey August through October of this year. Again, you know, I know that's a hard time for partners in terms of, oh, sorry. So the August, September would be when we would be creating the report of the self-assessment. I believe the self-assessment would be happening before that, but Anne, I'm not sure if you want to.
I'm seeing some requests to push back, I think, given time too. So I want to take those comments I see in the chat into consideration too.
Yeah, so curious if folks have thoughts of what would be, you know, ideal timing for the family survey and the partner survey, and then yeah, the interviews we'd hoping to do in the fall as well.
I think for the family survey, we won't actually be able to get applications from families until we get our stuff from the ELD, and then until we transform that and get our hub specific questions, and it's already March. So I think probably that would all need to just be pushed back at least 1 or 2 months so that we actually like have families who've been in the process that could respond to that, to those surveys. And then in terms of the hub self-assessment, thinking that August and September are like the most crazy of times in terms of enrollment, and maybe pushing that more back towards like an October or November. So hubs have the bandwidth to fully engage and have enough information to actually respond well, if that makes sense.
Mm-hmm, definitely.
Especially if you want family surveys from people who have gone all the way through the process and been placed and can now give feedback on their experience in the program. Mm-hmm. That's not going to be until, yeah, I would say family surveys should go through October again, so that they can reflect on the full scope of starting the application, eligibility, program choices, placement, and now my actual experience in my child's program.
How about the partner survey? Does October, November seem like, and you know, September can be a hard time for partners?
Yeah, I mean, I would imagine they're on a similar timeline, you know, with early fall, late summer being really crunched. So I would guess more aligned with when you're doing the interviews of hub staff, like early fall.
Awesome. That's super helpful. Thank you all. We'll make sure to take that back and make any updates that we can. And yeah, thanks again so much for all of you who have joined, and really just appreciate the super fruitful conversation and everybody being engaged in the discussion. I feel like we got a lot of really great feedback to inform, you know, what we're going to be thinking about for this year. And, you know, there will definitely be opportunities in the future for folks to provide feedback on, you know, tools and, you know, some of the questions that we're thinking. So just keep an eye out for that. And Anne, I don't know if there's anything else you want to say.
Very much appreciate everyone for bringing their thoughts, feedback, time to this. This is recorded, so we'll be sharing a link as soon as it's posted and available for you all. And we'll also include the links to the report as well as ELMO, which was the early learning map of Oregon was mentioned early. So make sure that you all have that if you can't find it easily on your own. I think that is it. Thank you so much and have a great afternoon, everyone.
Thank you.
Thank you.
Thanks, everyone.